Oh, you're on live now. You're on.
I'm on.
You're on. You're on.
Apparently I'm on. Good afternoon everybody, and welcome to our webcast from the child team around theory focused practice. For those who don't know me, I'm Margaret Chambers. I'm one of the lecturers in children's nursing at the University of Plymouth. And this person here, you'll meet in a minute, is Janet Kelsey, who is the programme lead for the BSc Honours in Nursing Child Health. We've divided our presentation up slightly, and I'm going to do the first bit, and as we're a double act, Janet's going to do the second bit, and then we'll bring things together at the end. The opening part will sort of set the scene as to forgot to look at the camera, and it says look at the camera and smile, so I'm looking at the camera and smiling. The first part is going to set the scene. It's going to tell you a little bit about what we mean by theory focused practice and the background to it, and Janet's going to talk about our action research project which we undertook over the last couple of years, and then we hopefully will get you to think about how you might be able to apply theory focused practice techniques to your particular programme of study. So, slide one.
Because you want me to press a button.
Oh yes,
as well.
please.
So
Thank
you
you.
have to
Thank
slide
you.
one. Okay.
So, theory focused practice. What is it? It's a way of enhancing learning in practice. We developed this teaching and learning method, and the major aim of it is to enhance learning in practice, drawing on experiential learning theories like problem-based learning and reflection on practice, which suggests that students learn more from their practice than they actually do when they're working in a classroom. Secondly, we wanted to find a way of reducing what we perceived as a theory-practice gap in nursing. Very often students were coming and relating practice to us that was maybe out of date or not based on evidence, and there's quite a bit of stuff in the literature that relates to a theory-practice gap in nursing itself. So we found that practice was not always being based on the best evidence available, and the secondary aim of the method is to promote evidence-based practice and support the students' ability to find evidence for their practice, and to give them tools and courage to be able to challenge practice that is out of date or not based on evidence. TFP it's based on, or takes the form of, focused learning outcomes that are linked to each module. So every module has some TFP associated with it. For example, in the particular model that I teach, which is about caring for children in hospital, there's a tremendous amount of work by Professor Peter Callery that looks at family-centred care from a different perspective. Peter has explored family-centred care, looking at the difficulties faced by parents who have to stay in hospital with their children, and looked at the emotional, social and economic costs of the same. Now, in a classroom I can spout Peter Callery till he pours out of my ears, but the students don't take it on board in the same way that they do if they sit down with a parent or a family and talk about what it really means to have a child in hospital and to stay in hospital and parent their children in public. Students, having met their learning outcomes in the practice area, they then have some time to search out the evidence base for what they've been learning in practice, and that is followed by facilitated feedback in the classroom. So the students are then sharing what they've learned in the classroom, facilitated by the module teacher, thereby strengthening the evidence base for children's nursing practice. Extra days are made available for TFP. The NMC requirements for students in practice is that they should be in practice for half of their learning hours. So in fact, when they do theory focused practice, they get a little bit extra time, because we take time from their theory, what would normally be spent in the classroom, and spend it in practice. So they get extra time in practice to be able to do this. So what we're looking for in theory focused practice is to find the evidence base for practice, to explore experiential learning and learning in practice, and incorporate problem-based learning into the student curriculum. Now, what we've got here is a couple of examples for you to have a look at from a couple of our modules. Again, this particular example comes from the module around caring for children in hospital, and it looks at safe practice. Each TFP has an aim, and the aim of this particular exercise is for students to consider risk management in the acute ward setting. So, starting at the ward door, the students are expected to explore the whole of the clinical area, and they're expected to do this section by section, looking at possible dangers or risks that are there for the child or the family or staff and other visitors, working on the principle that they're entitled to work in a safe environment in the same way that children are expected to be nursed in a safe environment. We give them some examples to look for. Is the corridor full of equipment? Is the kitchen or bathroom door propped open? Are all the sharps bins out of reach? So just our hands washed effectively, and so on. So just some examples of what to be looking for when they're undertaking this exercise. They're told to remember that not all the threats that they may come across are just physical threats. We want them to look at emotional threats as well, because obviously we're teaching holistic nursing care, and physical and emotional needs are just as important as physical needs. They're told to look for manual handling equipment to make sure that it's available and that it's used effectively and that it's safe and it's been checked to be risk-free. Look at ward policies and procedures, documents including the safety of medicines policy, for example, and look at how many of them relate specifically to children's wards and units. And this is quite important from our perspective, because all of our students are studying to be children's nurses in a district general hospital, so the environment that they're working in is not always conducive to the care of children. They're asked to identify whether the policies and procedures are followed at all times, and to query if not, why not? Why are they not being used? Thank you. Just a little word on the evidence that we ask them to look for. By evidence, we aren't just meaning evidence that's research based. We actually have looked at what is meant by evidence. And we want them to look at things like policies and procedures, to talk to parents, get information from parents and families, and also to look at anecdotal evidence. For example, another one that comes from my module is issues around therapeutic play. Evidence base for therapeutic play is actually quite weak, but it's very extensively used in practice because anecdotally it's been shown to work. And it's very difficult to do research into something that you know works, because it means you've got to take something beneficial away in order to prove that it's effective. So although there's a limited evidence base for therapeutic play, it's nevertheless inculcated into children's nursing practice. These are some of the other things we ask the students to think about. Things like, where are the fire extinguishers, how many are there, what are they for, and so on, and to be very clear about the hospital's fire policy. Also things like looking at whether the children are all wearing identification bands, and if not, why not, because there's all sorts of excuses why children aren't wearing them. How is the access to the ward maintained? Is there a safe way of getting in and out of the ward? And so on. So you can actually read the rest of them yourselves. How are incidents and near misses, drug errors prevented or reported, and so on. So that would be one. Another one is around informed consent. Again, this is something that can be taught in the classroom, but in order to explore it more fully, students explore informed consent in the practice area. So they look at the concept of informed consent and its application in the acute hospital setting, bearing in mind that our patients are almost all under the age where they would normally be expected to give consent for themselves. So what we ask them to do is observe a parent giving consent for surgery on behalf of their child. We ask who undertakes the task, who is the person who takes the consent from the parent, and who witnesses that. Who or was parental responsibility established? Again, in the current climate, that's very important, because very many children have parents and step-parents, and occasionally it's a step-parent who's asked to give consent when in fact parental responsibility does not lie with them. How was the procedure explained to the parent, and how was it explained? Was the parent able to receive information about possible complications associated with the surgery and the anaesthetics? Thank you. We asked them to record whether the parent was informed about alternative procedures and their possible side effects or consequences of refusing consent. And importantly, was the child included in the decision about the surgery? Because many children actually are quite competent to give consent without needing to recourse to parents, and it's very important that we listen to children and make sure that they're included in any decision making about their care. And afterwards, did a nurse or anyone else ask the parent if they actually understood what they were consenting to? Do children understand the surgical procedure themselves? And then we ask the students to reflect on the procedure and give their opinion as to whether informed consent was obtained, because there's an enormous difference between consent and informed consent. We ask them also then to observe the staff in the course of their daily work and look at whether consent's obtained for clinical and nursing procedures like medicines, or taking blood or doing blood pressures, and whether consent is given, or whether the nurse who's giving the medicines, say for example, actually just accepts implied consent when the parent takes the drug to give to the child. And again, does the child have any opportunity to be involved in decision making and or consent? So you can see there's an enormous amount that the student is expected to do on their day in practice during their TFP exercise. Now we want to take 5 or 10 minutes for you to think about how you could apply this method of learning to your area of practice. So we're going to give you 5 to 10 minutes in the chat room to think about that.
There's actually quite a lot of people in there, so don't be afraid to we've got about 20 people now, so right. But we'll stick with the one chat room, I think.
Okay.
We'll see how it goes. So we'll turn the sound off here so that they can burst into laughter and so on.
Right.
Okay.
Have a good laugh then. We've just been thinking about this, and there's a number of students taking part, and thank you for joining us and well done. We were thinking that maybe you can't apply this to your area of practice, but what you could do is think about some new theory-focused practice exercises that would interest you that we could incorporate into the programme. How about that? Okay, Maria, thank you for your comment, and we will be adjusting our TFP mentor handbook to reflect standard rather than universal. Oh heck, I keep forgetting to look at the camera. Standard instead of universal precautions, and thank you for that. Margaret, you asked about using it in community settings, and the answer to that is yes, we've used it in all settings. So basically we use it out in practice in the community with community nurses. We haven't so much done it with health visitors yet, because our health visitor placements and school nurse placements that tend to be, mostly health visiting, tend to be in year 1, and we don't introduce this process until our 2nd year. But we've used it with school nurses, we've used it in the community schools, the special schools that we use, mental health placements in the community. Any others, Janet? Well, basically every placement that we use in year 2 in the community has some TFP associated with it, and we'd be more than happy to let you have a look at some of the examples. Excuse me, some of the examples that we use for that.
There's more things.
Hi there, Amy. You were asking about medicine variations. We're just wondering, do you mean variations in actually how we give medicines, or the actual procedures for giving medicines in the community? Let us know, we'll think about it, but we can put it in by all means.
There's also this thing about supportive holding, yeah.
Ray's just saying that apparently we've got one about supportive holding. I think we should put that in, actually, and I think that would be a good one to put in, and we could look at the variations in techniques in supporting holding between community and acute areas, perhaps.
Amy says regarding specific conditions.
So, Amy, you're asking about supportive holding for specific...
No, I think she's medicine variations.
Ah, right, so you want medicines for specific conditions. Amy, we can do that, but I think you'll find it's actually in your pharmacology workbook. Which I'm sure you'll now find.
The other thing is that in our new programme in year 2, we're going to have a complete module called Medicines for Children, and of course we haven't written the TFP exercises for that, so we'd be quite open to looking at your ideas. So if you can come forth with some ideas sort of outside of this forum, it's Amy, isn't it, that's asking? Is it Amy that's asking about that?
I think so.
Then that would be very helpful, and you've also made me think that when I am starting to plan the module in detail, it'd be very useful to have some junior students around to give us some ideas of what's been happening to them out in practice and the queries that a medicines module can actually sort out for you. So that would be really helpful. If you'd be interested in that, Amy, drop me an email, please. Thank you.
We're just wondering if anybody's looking in from outside of Plymouth, do you have any similar sort of methods of learning or teaching in your areas? Have you thought about if you're perhaps one of the teachers, could you use this method in your teaching? Hi folks, just to say we'll give you just another minute and then we'll continue. Of the research that's there.
So when you want to...
Yeah, with regard to Chantel's comment about a TFP around bereavement, we certainly can look at that with Jill. One of the difficulties would be ensuring that you're exposed to that experience when you needed to actually do the exercise, but I'm sure we could look at adapting a TFP to meet your needs in that area. And what was the other one?
The other one, Margaret, asking about the students' views.
Yeah, Margaret, we're going on to look at the research in a minute with Janet, and she has got all the responses from the students from our research. But the other thing is that we've got loads of our students here joining us this afternoon, so I'm going to ask them to send you a few messages about how they feel about it. And they understand that we're quite open about, you know, criticism, because if we get constructive criticism we can feed that back in and improve the method. So if they've got anything good or bad to say, we'd be quite happy to receive their comments through the chat room.
Okay, so we're going to continue now. What we're going to do is just run you through the research process so far, how we've carried it out. before we actually started the TFP, what we decided was we really needed to actually ask other lecturers in other universities if they had the same feeling as we did, that maybe the theory-practice gap had still not gone away. So we actually surveyed the other UK universities, and we did this by asking all of the programme leads for child nursing across the UK to answer, and we had a fairly good response rate. I think it was about 75%. The next thing that we had to do was introduce the process, because although we've been doing PBL and reflection and things like this, we hadn't actually carried out anything that mixed everything together before. So we needed to introduce the process to the students and to the mentors. And we introduced it to our second year students, and they were the first group through of our degree programme. So it was quite a lot for them to take on board, but they came along and they were asked if they wanted to take part in the research. They were not given the option of whether they wanted to actually take part in the TFP, because that is part of our programme, but they were given the option as to whether they actually wanted to take part in the research. But unsurprisingly, all of them actually took part, and those students, you'll see their comments coming through later, and they've actually gone all the way through, as you can see at the bottom here, to a student-led conference paper a couple of years ago. When we were introducing this to the mentors, this is where we asked our research assistant Leslie to go out and prepare the mentors for us. This was actually quite a huge task, because we have students spread across the whole Southwest Peninsula. That meant that we had to prepare mentors across the Southwest Peninsula, and as we've said, they had to be prepared in not just acute areas but all of our community settings. So we actually had to start preparing the mentors about 6 months ahead of when the project started. We had student focus groups, and we had 3 groups. Again, there were volunteers, 3 groups of 8 students, and some of those results will come to. We also questionnaires students and mentors, and these questionnaires were actually an evaluation of what they thought of TFP, how it had improved their learning or not, or what effect it had had. Following that part, we then presented various conference papers and posters, and as I say, I think the most important one for us was actually the students presenting a paper in September, and that was at a national conference. And that was exceedingly good, not only for us but for the students as well. And since then, the students have commented, the ones that took part, how although they were terrified at the time, actually it's been good, because they say that when they go for interviews now, there's very little fear to be had by facing a room full of strange people when you've faced a conference room. And last, of course, we have published 1 journal article, 1 short paper, and we'll give you the reference to one of these at the end, and another paper's in progress at the moment. So what did we find? Well, the preliminary survey of the child health academics, the whole purpose was, as I say, to elicit the views of these academics in the UK about children's nursing students' use of evidence to underpin their practice. So we really wanted to find out if other academics were finding that their students were using evidence to underpin practice. The survey did not conclusively acknowledge this theory-practice gap. We were quite surprised, because we felt we'd have some strong evidence to support that the theory-practice gap still existed. However, it was not as strong as we anticipated. There were comments that some students were not considered to be utilising the theory to support their practice, or maybe they needed prompting to do so. Not surprising when you think about it, because we asked about all groups of students. Almost half of the respondents who came back accepted that when their students witnessed poor practice, they quite often had difficulty in challenging it. We didn't actually ask them at that point to expand on why they had difficulty. It was just one of our questionnaires, one of our questions. Following on from this, we sort of looked and we asked them about reflective practice and modern teaching and learning methods, and they acknowledged that they did actually promote evidence-based practice. However, what the majority of the education people who came back at us said was that it was the maturity, the ability and the experience of the student which really influenced their ability to find, analyse and incorporate evidence into their practice. So it was perhaps easier for the students who came along, who were the second or third years, to actually challenge poor practice rather than the first years. They found that as they developed as a more confident student leading towards a practitioner, then they were able more to challenge practice. But they did find that there was this strong influence of experience on their ability to analyse. The student focus groups, these actually showed the views from the students, which demonstrated a wide range of opinions on whether practice was supported and underpinned by evidence. Some of the students were absolutely convinced and felt wholeheartedly that practice was fully informed and research. However, others in sometimes the same areas found the practice they were seeing to be based on tradition. And they found very often that advice was taken from senior or more experienced staff by the junior members of staff, rather than people going away and finding out for themselves. They would prefer to ask another member of staff. And it's acknowledged that in a busy area, sometimes it's best to go and ask another member of staff. You trust their opinion. However, they didn't feel that all the time staff were going away and looking at the most recent evidence to support their practice. Many suggested that protocol and policy documents were evident, which was a relief, and that these were being utilised by everybody. And the students were definitely encouraged to follow procedures and protocols. However, they also found that in some cases a variety of sources of evidence were used, and these could be procedure books, journals or electronic databases. So again, this was good to hear. It wasn't just that it was a case of go and ask the most senior member of staff. It really was that they were starting to see staff using different sources to actually support their practice. On the negative side, when they were looking at policies and protocols, the students did come back to us with some concerns that not all of them were up to date, and definitely not all of them were seen to be evidence-based. They may well have been, but because the students took things as evidence-based, if they could find a reference that supported it. So if the protocols were not evidence-based, i.e. not referenced, then they said they were not evidence-based in their way of thinking, which is fair comment. And we have actually seen recently a change, I think, in some of our areas. When we fed this back to some of the areas, they have now started to write in the supporting references to back up their policies. One of the students commented that there were conflicting practices, and in particular, sometimes between the home carers and hospital staff. Hospital staff would be following one policy, but the home carers would be following another policy, and these did not always say the same thing. In general, if we look at the focus groups, the data was very varied. Some of the students were very positive about their experience. They were very positive about the existence of the evidence base. However, there were a substantial number of negative experiences, and it was clear that the students in the focus groups were recognising when practice was not evidence-based, and in many cases were challenging non-evidence-based practice. So the students' experience. And I have to say that the students' experience part of this presentation was actually written by the students, not by us. So the students' experience, they did find it to be a progressive learning experience. They started off not really understanding what they were doing, why they were doing it, how it was going to actually improve their learning. But as they continued along the line of using it, they found it did help. So they had a vague understanding of what we were doing to start with. They had a vague understanding of the benefits behind the activities we were asking them to do. What they immediately felt was the pressure of more work. And we have found that our students coming into the second year do find that when we're asking them to undertake TFP in practice, as well as to spend time in the practice areas learning all their new skills, they say it is an awful lot more pressure on them. However, by the time they get to the third year, they're seeing the benefits of it. The other thing that the students said was that there were no grades attached. So we have actually looked at this, and we've tried to find a way of attaching grades to the TFP. This is not something we're actually very successful at yet. At the moment, we've got as far as their TFP is incorporated into their portfolios of professional development, and they present their TFP as part of this to the external examiner. In fact, some of the students actually have two portfolios, one which is their normal one and one which is their TFP portfolio. And what they're doing is they're recognising that when they're coming to ready to qualify and go on to look for jobs, they're thinking that actually this TFP and the way of learning will be very beneficial, and they're going to be using it to interview. So the benefits that the students came up with, very much that they could take control of their own learning. They were not sitting in a classroom, they were not being directed into groups by us on a daily basis. They were actually out in practice. They were learning as they went along, but they were learning the evidence base as they went along. And it wasn't quite so ad hoc as go to the practice areas and learn. It was very much, it gave them a little bit of direction about some of the things that they could actually be taking advantage of and learning more about in their practice areas. They did say to us that they definitely discovered a passion and drive to gain knowledge, and that grew once they had got over worrying whether they were doing it right. They have definitely learned how to question practice and challenge practice, and this has ranged from very simple incidents of asking people to wash their hands, but going along with the washing hands theme, we have had students actually stop ward rounds in their tracks and challenge a whole group of consultants as to why they have not washed their hands between patients. So just on the hand washing TFP, it has certainly given them the confidence to challenge practice. Another benefit which they by no way undermined was that it did enhance their skills in finding evidence. Because they were looking for such a varied amount of evidence and to support different types of clinical skills, they learnt a lot more about where to look for things. So it's actually helped them, we hope, when they get to year 3 and they're doing their research dissertation, we hope that doing TFP has enhanced their evidence searching skills. So overall, well, they did enjoy it. Honest, they did enjoy it. It's hard work, but it gets there. It did give them to focus, so they could focus on relevant topics for their practice areas. So as I said, it helped give them a little direction whilst in practice. In doing so, it definitely did help them to relate theory to practice whilst they were in hands-on learning. Mentors' experiences. Okay, so if I feed back this part, and again, I think Margaret's looking at me. Margaret's thinking she's feeding this back. Hang on, we'll just swap the mics.
Oh, you're right, I am.
She is feeding back. She's just woken up from 40 winks.
Sorry about that. Mentors' experience, yes. We sent out questionnaires to the mentors who supported the students whilst they were undertaking their first lot of TFP, and we had 39 respondents, which was quite good. It was more than half, which we were very happy with. And on the whole, the mentor respondents were very positive. Most of the mentors were in agreement with the outcomes of the TFP, the positive outcomes. They all either agreed or strongly agreed that students were able to link theory to practice in a more practical way, having undertaken TFP exercises. 90% of the respondents thought that. 90% also thought that the TFP encouraged our students to cite examples from practice based on evidence. 93% of them said that TFP helped the students to recognise relevant and up-to-date practice, and 94% of them said TFP gives students confidence to question the evidence base for practice. There were some comments as well as some number crunching. They said it was a very one mentor said it was a very good way for students to link theory to practice. It enables them to understand why they are undertaking a procedure and allows them to research relevant information at the exact time it's needed. Another said, before TFP it was harder for students to be aware of how practice was evidence-based. Another said it encouraged more inquiry into research and guidelines, and TFP has made students and nursing staff more aware of up-to-date practice, as written policies and procedures or other theories can be out of date. So that fit in really well with what our students were telling us, that they would find the policies and they often hadn't been brought up to date or were due to be renewed. And similarly, the skills that the staff were practicing were also out of date. So another mentor said, depending on the attitude of the student, the impact is a positive one. It encourages the questioning of staff when the student feels uncertain about asking. It's positive for staff who are questioned about practice and beliefs. It encourages accessing up-to-date and relevant theory. Again, I think it's also important that mentors have a positive outlook, and that they don't see TFP and the questioning of practice as a threat in any way. That's not what theory-focused practice is about. And hopefully, you know, we all have very close links with our practice areas, and we hope that as a result of that, our mentors are seeing the challenges to practice in a positive way and not a negative way. We want to look a little bit at the challenges and benefits. First of all, the challenges. Our first problem was the students' perception of workload. Students spend year one of the BSc working with other nursing students, and then they go into year two and they're faced with this theory-focused practice thing. And they know that mental health students and adult students are not doing the same thing. They got the idea that the TFP work was over and above what everybody else was doing to get their degree. So one of the challenges was to make them understand that we were giving them just a different way of learning, that if they weren't out in practice gathering this information, if they weren't then looking for the evidence base and then feeding it back, what they would be doing instead would be sitting in a classroom and listening to a lecture. So it took a little while for the perception of workload to become clear. Similarly, we had a similar problem with the mentors who thought that they may possibly end up doing more work, but many of them have now told us that actually they have to do less work because the students are actually looking for information and bringing it back to them and improving their practice by improving their evidence base for practice too. Preparing of the mentors was definitely a challenge because, as Janet said a little bit earlier, we have students placed all over the Southwest Peninsula in community and in hospital settings, and all of them had to be prepared. So some of the money that we had for our research project was spent in having a research assistant who could go out and prepare all the mentors for us. And finally, staff workload. You have to consider that if you're facilitating the feedback of these theory-focused practice sessions, you certainly have got to have the knowledge and the evidence to support what you are facilitating in the classroom, and that meant that all of us also had to be very up to date on every subject that we asked our students to research. Thanks. So now we want to stop again for 5 to 10 minutes, and we'd like you to think about the challenges and benefits that might arise in your area of practice for the students, obviously, what you see as the challenges and what you see as the benefits of theory-focused practice. And we know that quite a few of you out there are either year 1 or year 2 students, so we'll be really interested in what you think the benefits of TFP might be to you. And so we'll give you 5 or 10 minutes now to give us your views in the chat room.
Can I?
Hi Margaret, you're asking about 50% response rate and if we've any idea why we didn't get any more. Unfortunately no, because of course they didn't actually respond. We did 2 mail shots. We got about 40%, I think it was, on the first set of questionnaires we sent out, and then the rest came in afterwards. So although 50% is great, we sort of thought, well, if you look at a lot of the questionnaire response rates that go out, that wasn't too bad. And in addition to that, what we also have, of course, is we do have anecdotal evidence from our own discussions with the mentors. And much as we can try and get them to answer the questionnaires, their anecdotal evidence also supports those very positive views that were given there.
And you had a question from me.
I have a question from Ray sitting in the hot seat here.
Which was, it's a comment really, just interesting to note how, in a way, that you're using students as an agent of change, if you like, for the rest of the community. And I think that it's something that I think a lot of us could do. I know that our colleague Janet Richardson is thinking about how, and the sustainability group is thinking about how we might get students to try and encourage sustainable practices in trusts. I'm also interested, I saw that Matt Breckens is there in the chat room, and Matt has been trying to encourage the use of evidence by practitioners of complementary medicines, and is really exploring how you might get a change of an organisation. So I just wonder if you had any comments on that, and maybe if Matt or anybody else in the chat room's got any comments on that.
I think actually what you're saying is true, Ray. We are definitely seeing that the students are instruments in change, and I think what we probably didn't start off with saying was we started all this way back because of our students. We were teaching them skills in the skills lab, and we were teaching them according to latest guidelines and evidence, and then they would go out into practice and they would find that those skills were being carried out in a different way. So once we've explored with them, well, is it still safe? There's not always just one way to do something. Sometimes there are many ways to reach the same objective. But one thing that comes to mind was the dreaded nasogastric tube testing, and we started our TFP way back when our students, we taught them about testing nasogastric tubes with pH paper, and they were still coming back and telling us about blue litmus paper being used in practice, and of course the whoosh test being used in practice.
Dreaded whoosh test.
And this was where this sort of started, because we were saying very firmly, no, you have to be confident that you have the most up-to-date evidence to support your practice. Go back and say, why are you doing it this way? This isn't the way we've been taught. And so they did. And actually we found that slowly but surely the students were being listened to, and they were being listened to in quite a big way, because the trust started to hear what the students were saying and they changed their practice. And we actually had one particular trust which changed their practice before they were told they had to by the management. So we think that's an amazing thing to happen. And it's happening on a small way. I mean, I used the hand washing, but one of the big challenges is to keep students keen to wash their hands, keep them washing their hands. Maria, I know you're listening. So how do you keep them washing their hands? Well, unless you keep reminding them of the importance. And this is one way of doing it, because the students are constantly reminded, but when we then ask them to go and look at other people's hand washing, and we ask them to review it at regular intervals. So we're finding that it's using a way of getting different things across to people, and the students, you're right, they're agents of change.
Yeah, we had another really good example of that when we had a student who was working with a young woman who was an anorexic patient, and she looked at the treatment and care that the patient was being given, and also looked at the guidelines from the NICE organisation and found that they weren't being used. And she felt strong enough to be able to challenge that and say, why are we doing this when the guidelines say we should be doing that? And as a result of that, the guidelines were incorporated into the practice of that unit. And as a byline, Janet has been invited to be on the practice development group of one of our trusts as well. And all of this is benefits that have come from being from TFP.
Okay, I'm just picking up a few comments off the screen here, and we've got some of the students saying that it is definitely a benefit, and I'm glad you are saying that, guys, because that is certainly echoing all the students that have gone before you that we've done this for. But it's just interesting to see that without being part of a research project, which you could say actually swayed some of the results for the students you'd seen in the presentation, the students that are here are not part of a research project, they just do TFP as part of their programme. So it's good to see that they are still seeing a benefit. I'm a little confused by one of the comments about the blood pressure. So Claire, if you'd like to come back to us as to what exactly you mean about blood pressures, then we'll try and answer it. Okay guys, we've just looked at the clock, and despite thinking that we'd only take 10 minutes to race through this at a fair old pace, we seem to have taken an hour already. So we'd best finish up with the last part of the presentation, and that is about the benefits. First and foremost, student learning. Definitely. The students are learning. They are learning in a much more proactive way, and that is benefiting them. It's benefiting them not only in the depth of their learning, but in their application of it. And also, our external examiner, interestingly enough, has sat in on our TFP feedback sessions, and she's convinced that our second year students, their level of analysis is actually being improved by using TFP. She thinks that our second year students have a greater depth and level of analysis than she sees in other universities. So that's great to hear. So I think that is a definite plus for student learning. Another benefit for this group of students who were involved in the research, it was an experience for them. They learned by them, for themselves, what questionnaires were like, how to develop questionnaires, because we asked them about what questions there should be in. They learnt about focus groups, how focus groups are run, and then they learnt how to present the research at a national level. So it was definitely a benefit to them. Interest from other professional groups. We have had interest from other professional groups, and we are trying to follow those up. And not only here, but also in Finland, we've had interest from abroad about using this as a method, as Ray says, to try and encourage change and to try and continue change from the ground up. It has definitely challenged, and it has changed in appropriate practice, as well as recognising good practice. We have developed a pharmacology resource guide, which the students use now. So the current students who are using it didn't realise it, but that's where it came from. And last but not least, from the team's point of view, because we had a teaching fellowship followed by a Keppel fellowship to carry out this research, it increased our research activity. It made us much more active, and it increased our publications as a team. So to summarise, yes, TFP does seem to encourage and improve learning in practice from practice. It uses focused learning outcomes, it's linking the theory from our modules into the practice, and it seems to be strengthening the evidence base for children's nursing, not only in our students that are actually carrying out the TFP, but also in those that surround them, so that's got to be good news. And I think this is, we've just put up one article. I didn't put up the short paper, we've just given you the reference for the article here, which gives the background to the TFP. More will be on the way. We have a paper in process at the moment, waiting to go to press about the results, so keep a lookout for that if you're interested. I think the last slide just says, any questions? And thank you very much. We're going to escape from in front of the camera.
It's goodbye from her.
And it's goodbye from me.
And goodbye from both of us.
You stay in